Bismillahirrahmanirrahim. So we're gonna discuss about the syndromes that are related to pons and medulla today. So in the last video, I have gone through the syndromes that are related to the midbrain, right? So let's go through the syndrome related to the pons. So if we see the structure of the pons, so this is a cross section of pons. So we can see the six nerve nucleuses here. This one is the facial nucleus is here, and this is the lateral spinothalamic tract that is present on the lateral aspect of the pons. We can see this is called as the vestibular nucleus, right? And this is called as the trigeminal nucleus, right? Sensory component of the trigeminal nucleus. And this structure, this is called as the descending sympathetic pathways, right? So we'll have this artery that is called as the basilar artery. We can see this one, right? So this is a basilar artery, and this branch is called as the anterior inferior cerebellar artery. On the posterior aspect, basically we'll have the cerebellum here, right? So we'll have this another structure that is going to connect the cerebellum with that of the to the pons, that is called as middle cerebellar peduncle, right? So middle cerebral peduncle is going to connect the pons to the cerebellum. So let's talk about what's going to happen when we so these are the little branches of the, so we'll have the little branches that are going to supply the anterior aspect of the pons from the basilar artery. So what's going to happen when we just impair these branches, right? When we occlude these branches, what's going to happen? We'll have this syndrome. So we know that this is called as the corticospinal. These are called as corticospinal. This is called corticospinal pathway, right? So basically we'll have descending fibers from here, from the anterior aspect of the pons, just like midbrain. We'll have the crus cerebri in the midbrain. So these are the basically descending fibers of the corticospinal pathways, right? Okay, so if we occlude this area, right? If we just occlude this area, so what's going to happen? If we just, when there is ischemia of this anterior aspect of this area, so we'll have this syndrome that is called as Millard-Gubler syndrome, right? So we can see the seventh nerve is passing through this, and sixth nerve is also passing through this. So we'll have ipsilateral sixth nerve palsy, ipsilateral seventh nerve palsy, and there will be contralateral hemiplegia because the corticospinal fibers are involved. So we'll have sixth nerve palsy, seventh, and contralateral hemiplegia. So this is called as the Millard-Gubler syndrome, right? So this is called as the Millard-Gubler syndrome, right? If this artery gets impaired, so if I block this artery, so what's going to happen? There will be ischemia of this area, right? So there will be ischemia of this area, right? So what's going to happen? We'll have the features like when the facial nucleus is involved, right? So we'll have the ipsilateral seventh nerve palsy, right? And paralysis of face, and also there will be decreased lacrimation, salivation, and the taste from anterior to third of the tongue. When the vestibular nucleus is involved, so what's going to happen? There will be vomiting, vertigo, and nystagmus in these patients, right? When the spinal thalamic tract is involved, so this one is spinal thalamic tract, lateral spinal thalamic tract. So patient is going to have the features like contralateral pain and temperature loss, pain plus temperature loss, right? And when fifth nerve is involved, so we'll have the features like ipsilateral facial sensations will be lost. So these two features are called as when there is contralateral pain and temperature loss and ipsilateral facial sensations are lost. This is called as crossed hemi anesthesia. Because the fifth trigeminal nerve that is involved on the ipsilateral side, and on the contralateral side will have the pain and temperature loss. This is called as the crossed hemi anesthesia, right? So when when these sympathetic fibers are involved, so what's going to happen? There will be Horner syndrome, right? So when in Horner syndrome, there is a little mnemonic for that is called as perfect meal, right? So the features of Horner syndromes are like that. There is ptosis, there is meiosis, right? There is inophthalmos, there is anhidrosis, and there is loss of ciliospinal reflex, right? So this is called as the Horner syndrome, right? And we'll have this cerebellar peduncle will be also is gonna get involved. So we'll have the features like sorry, so we'll have the features like ataxia and dysmetria, right? So we'll have the features like ataxia and dysmetria, right? So all of these features are called as the lateral pontine syndrome, right? These features are called as the lateral pontine syndrome, right? Okay. And this, if only sixth nerve is involved and seventh is involved and there's controlled hemiplegia, so we're going to call it as Millard-Gubler syndrome. So you can see that in lateral pontine syndrome there is no hemiplegia, right? Okay. So now let's talk about the another syndrome that is called as the locked-in syndrome. So what's going to happen in these patients? So if we occlude this basilar artery, right? So basilar artery is coming from the down below, right? Actually this is a combination of the two vertebral arteries. They combine and form the basilar artery, right? If we occlude this area, so what's going to happen? There will be various nuclei are involved. So in these patients, there will be both of the corticospinal fibers gets impaired. So patient is going to have the quadriplegia in the right, and patient won't be able to talk, eat, and drink because the 9th and 10th nuclei are also involved, right? So 9th cranial nerve nuclei and 10th cranial nerve nuclei are also involved. So patient is going to have the he won't be able to talk and eat and drink. So only movement possible in these patients is the vertical eye movement, right? So this is actually controlled by vertical conjugate movement is controlled by superior colliculus, right? Okay, so only this movement is present in the body, otherwise they'll be like prisoner in their own body, right? So this is called as locked-in syndrome, right? So sometimes when we'll have this here we'll have the reticular formation that is called as the paramedian pontine reticular formation. If it get involved, so the consciousness, this is called as the reticular activating system. If it gets involved, so we're gonna have the features like patient won't be able to retain his consciousness. Patient will remain unconscious, right? So if sometime if it is spared, so consciousness will be preserved in these patients, right? This is called as the locked-in syndrome. So we'll have three syndromes related to the midbrain, right? That was the Weber syndrome, and another one was the Benedict syndrome, and the last one was the North-Nagel syndrome, right? So three syndromes that are related to the midbrain and three syndromes that are related to the pons, that is lateral pontine syndrome, right? Then we'll have the Millard-Gubler syndrome, right? And then there's locked-in syndrome, also known as pseudocoma, right? So we can, okay, so let's talk about, so that's all about the syndromes related to the pons. So let's talk about syndromes related to the medulla, right? So let's talk about this thing. Okay, we'll have two syndromes related to the medulla. So one is called as the medial medullary syndrome, another one is called as the lateral medullary syndrome. So in the lateral medullary syndrome we'll have the various features, right? So let's talk about this thing. So we'll have the restiform body here on the posterior aspect. Let me change the color. Alright, so we'll have this thing is called as the restiform body, right? That is basically this is going to connect the medulla to the cerebellum. When it gets involved, the patient is going to have the gait ataxia, right? And intentional tremors and hypotonia, right? Okay, another thing is we'll have another descending sympathetic fibers are here, right? This pathway is here. So when it gonna involve, so we'll have the features like Horner syndrome, that is called I just enumerated the perfect meal for that, right? perfect mitosis, there will be meiosis in ophthalmos, right, and hydrosis and loss of ciliospinal reflex. Alright, so when there is trigeminal nucleus involved, so we'll have the ipsilateral sorry, we'll have the ipsilateral loss of sensation from the face, right? And when the lateral spinothalamic pathway is hampered, so we're gonna have the features like loss of pain and temperature, pain plus temperature from the contralateral area of the body. So we'll have these two together are called as the crossed hemianesthesia. Right? So when the eighth nerve is involved, so we'll have the vomiting, we'll have the vertigo and nystagmus, and these patients sometimes there is when the cochlear compound is involved, so there will be sensorineural deafness, ipsilateral sensorineural deafness plus vomiting and vertigo because of involvement of the vestibular nucleus. Okay, so when this one is called as the tractus solitarius nucleus, that is related to taste. So we'll have the 7th, 9th and 10th, these are related to taste. Anterior 2/3 of tongue is carried, the taste is carried out by 7th, and posterior 1/3, the taste is carried out by 9th, and posterior most part of the tongue is carried out by 10th. So we'll have these three cranial nerves that are gonna connect to the nucleus of tractus solitarius, right? So when it gets involved, we'll have the features like agusia, right, loss of taste sensation, right? Okay, let me change the color. Okay, right. So when the nucleus ambiguous is involved, so what's going to happen? 9th, 10th and 11th, these are connected to the nucleus ambiguous, right? So because of the involvement of 9th cranial nerve, so patient will be having the nasal twang in the voice, right? And because of the involvement of the vagus nerve, so patient is going to have the palpitations, is going to have the gastroparesis like symptoms and bloating like symptoms, right? All right, so that's all about the lateral pontine syndrome. And the lateral part of this pontine that is called as lateral medullary syndrome, and this part is supplied by we know that the artery that is called as the pica, right? So we'll have this, we can see this one is vertebral artery, this one is the vertebral artery. Okay, that is going to supply the lateral aspect as well, right? So in the lateral medulla, sometimes vertebral artery is involved, vertebral artery or pica is involved in these patients, right? So in lateral medullary syndrome, we'll have the pica involvements, right? So basically lateral medullary syndrome is also known as Wallenberg syndrome, right? So mostly we'll have the vertebral artery involved. So we'll have the various nuclei that are involved in these patients, right? And there will be no hemiplegia in these patients, right? So that's all about the lateral medullary syndrome. And there is another artery. So from the we have the from both of the vertebral artery, we have another artery that is called as the anterior spinal artery, right? So this is going to supply the medial aspect of the medulla, right? So what's going to happen? We'll have on the medial aspect, we have only one cranial nerve that is present here, and we'll have these structures that are called as the pyramids. So basically this is the olive, this is pyramid, so this is also pyramid, and this one is called as olive, right? So olivary nucleus is there. So in the pyramid, we'll have the pyramidal tract, right? Basically corticospinal pathways. When there's hemiplegia, contralateral hemiplegia, and 12th nucleus is involved, right? So this is called as the medial medullary syndrome. So we'll have the ipsilateral 12th nerve palsy, right? So tongue will be deviated on the same side, right? And there will be contralateral hemiplegia, right? And the artery involved, that is called as the anterior spinal artery, right? So this is called as the medial medullary syndrome, right? So I'm going to discuss the management of the stroke section in the next video. So that's all for today, right? Okay.